Dr. Mari Winkler, good afternoon. You have been supported by the AXA Research Fund to conduct a research project on monitoring of COVID-19 in wastewaters. Could you please first share with us the main goals of your project?
Yeah, of course. But before I start explaining that, I would like to thank you of selecting me as a fellow. I'm very excited to be able to do the work I'm going to present. So thank you so much. It's an honor. So this project is really about monitoring SARS-CoV-2, the virus that causes COVID-19 in the sewer system. Reopening the economy and allocating medical resources efficiently requires scaling our capacities to track, test, and treat COVID-19 infections. So the advantage here is that one sewer sample is representative of an entire community, hence capturing the infections within that neighborhood with just one sample instead of testing all the people individually. And that really offers continuous monitoring at much lower cost. So the major goal is to monitor wastewater pumping stations to detect SARS-CoV-2 in communities ahead of individual testing.
Great. And what do you see as the main advantages of this particular approach?
Yeah, so this method can also test difficult to access communities that may live in congregate facilities, such as, for example, homeless people, farm workers, or people without legal residency status that might be afraid of deportation, unfortunately, if tested. So this method will also capture asymptomatic people that wouldn't get tested, as most facilities only test people with symptoms because we are also limited in resources. So in short, monitoring wastewater allows us to understand social disparities, enabling comparing of those neighborhoods with varying demographics and access to testing. So it's quite an exciting approach. So the data could be used to lock down certain parts of the city and then conduct directed contact tracing, for instance. It could also be used to measure at different nodes within the sewer system to track down the source of SARS-CoV-2 within a neighborhood, or later on could be used to direct vaccination trials. And then once they have been applied to a community, so to say, track their effectiveness over time.
Great, this is very clear and this is a highly promising project. Do you think it could be replicable, and how do you foresee its use for other populations or other diseases?
Yeah, so first of all, I would like to start is that environmental sewer surveillance of viruses is actually nothing new. It has been used for instance, polio in different countries. An example is Pakistan. However, so far these approaches have been focused on the endpoint. So the sewer is collected and then it goes down to pumping station and ends up in the wastewater treatment plant. And by the time it hits there, the signal of the virus can be very dilute by rainwater, by all different kinds of sources. And the virus signal could be degraded significantly because it spends a long time in the sewer. So by checking, by using this approach, one can reflect what's happening in the entire city. But it doesn't allow to look at individual kind of zip code within a city. So the approach we are using here can look at those zip code levels, and also the advantage is that it might have a very stronger, might have a stronger signal that is less dilute, and also where the virus is preserved in higher concentration. And then we can pinpoint that outbreak to specific areas in the city. and then trace COVID-19 prevalence on a much, much finer scale using the SURE.
Thank you. I'm now interested in the impact of your program. So can you tell us more about how does your research impact society, specific population, and the decision makers?
Yes, so policymakers are having to make costly decisions on restricting certain business sectors. We see that now there's a second surge coming up in Europe, and many other countries are, of course, impacted by this disease currently. So pumping station monitoring could help offer in any kind of country to get a much quicker feedback in effectiveness of their policies through proactive sampling, because the virus often shows up in the sewer before it is detected with individual testing, before people get symptoms. And as we know, some even don't have symptoms. So this could help decision makers to be more nuanced in their approach and maximize the benefit to cost ratio of policy invention. Additionally, once the vaccine is available, policymakers will need to create a strategy to those who vaccinated, for those need to generate a strategy to vaccinate those who really need it the most. So sewer sampling will allow the distribution of vaccine to target communities that need it the most, vulnerable communities, and then really reduce the costs of individual testing that also currently are really restricted. I also would like to just say for kind of a future vision, so the approach being used here might be also used for non-viral trends to trace down major polluting sources and hence prevent discharging harmful components into the environment. And actually, King County Toxicology Department is interested in this approach for future studies. So all in all, this is a very exciting project. Yeah.
It is, definitely. Thank you so much, Dr. Winkler, for taking the time to answer my questions. I wish you all the best for your project, which you are very proud to support. And we keep in touch when you get the first advancement.
Yeah, thank you so much. I very much appreciate your support. And last but not least, I would like to thank my team who really also make this work possible, and other heroes going out into the field and collect samples. So with that, I would like to thank Raymond Redcorn, Peter Kandrai, John Carter, and Bao Nguyen Kwok. And I also would like to mention my colleague and collaborator, Professor Dr. Scott Meschke, for really his great help and collaboration on this project.
Thank you so much. And again, congratulations to you and all your team. Thank you.
Thank you. Bye-bye.
Bye.